Hypophosphatemia is associated with increased risk of mortality in ICU patients. Phosphorus is important for human body, for normal neurological functioning, and muscle contraction. Hypophosphatemia is a common electrolyte metabolic disturbance reported in critically ill patients. Several studies have shown that hypophosphatemia is associated with increased risk of muscle dysfunction and arrhythmia, and longer hospital and ICU stay. The aim of the study was to determine the association of hypophosphatemia and the risk of 28-day mortality in ICU patients. The study involved reviewing data of patients who were aged 18 years or above, whose serum phosphate level were measured at the time of admission in the ICU, and survived up to 28 days after admission. Patients who were pregnant, or stayed in hospital for more than 180 days, or had serum phosphate level more than 1.60 millimoles per liter, were excluded from the study. The retrospective, single-center study included 946 patients. Based on the serum phosphate level at the time of admission, subjects were divided into two groups. Normal phosphate group included 442 patients, and hypophosphatemia group included 504 patients. The ICU 28-day mortality and its association with phosphate level was evaluated. The risk of ICU 28-day mortality was higher in patients with hypophosphatemia as compared to the patients with normal phosphate levels. The study results concluded that hypophosphatemia at the time of admission in general ICU patients is an independent risk factor for 28-day mortality.